Well, good evening, everyone. I'm Dr. Michael Twyman. I'm a heart attack prevention expert, a biohacking cardiologist, which means health optimization in my mind. And tonight we're going to talk a little bit about photobiomodulation and cardiovascular benefits. So what is photobiomodulation? How do you use light to affect your biology, ideally for a positive effect? So many of you have heard me previously tell the story, and I'll use this time to kind of catch people up on my backstory and how I got into biohacking, and then we'll get into tonight's topic. So originally got into biohacking in 2017 when I went to Bhutan. Bhutan's a country about the size of Indiana, and it's about 14 hours away from where I currently live. So it was going to take quite a long time to get there, and I did not want to necessarily die from the jet lag. So did some research on how to optimize your circadian rhythms, not die from jet lag, and I ended up buying a pair of blue blacking glasses, different manufacturer than the ones I'm currently wearing. Ended up wearing them on the plane. Jet lag wasn't as bad when I got over there, and so I thought, well, there must be something to this light thing. And so when I got back, I had been doing a deep dive into how light affects your health. And then came upon photobiomodulation, or what was previously known as LLLT, which stands for low-level laser therapy or low-level light therapy. So this is an area of research that's been fascinating to myself for the past year or so, and has a long history. Initially was discovered in the 1960s. They had created the laser in the early 1960s, and they were actually trying to see, did lasers cause cancer? And in this study, Indra Mester from Budapest was looking at mice and rats and shining red lasers on their abdomen, trying to induce cancers or tumors, and it turned out that the incisions actually grew hair back faster, and they didn't understand why at that point, but that was the first sign that red light might have actually had a biologic effect for the positive. And so then the research really started after that point. Of note, it's also the same year that coronary bypass grafting was initiated. So getting your arteries replumbed by a cardiothoracic surgeon was the same year as they figured out photobiomodulation maybe did something. And so that would pique my interest, is that, yes, I'm a board certified cardiologist and a semi-professional biohacker, but I was interested in how does this red light therapy or infrared therapy also at times affect the cardiovascular systems, which is going to be the main thing that we're going to chat about tonight. So I did, for those that are just joining, thank you for joining, everyone. This will be saved for Instagram, TV, and also likely be put up on my YouTube channel. I've also recently launched a website called redlightdoc.com that has my previous photobiomodulation talks. I also have a talk on there about sauna, because I frequently get asked about questions, is sauna the same thing as red light therapy? They're not the same thing. They both have benefits, but they're a little bit different, so those differences are explained in that video. I also have my favorite links on that website. I have a calculator, because that is one of the hardest things with this photobiomodulation, mouthful, is how to figure out the exact dose you should use to treat yourself. And this is even complicated for myself. I probably spent about 12 hours in the past 2 days trying to figure out this stuff. And so I'm going to start just trying to introduce it slowly, and we're going to be doing more and more of these red light talks over the next few weeks. But redlightdoc.com has my previous talks, also has a link to the device that I have currently over on my shoulder here. Chris from EMR-TEK was nice enough to promote the talk tonight. So I know some of you are some new followers, so welcome. But EMR-TEK makes a very nice box. Chris is very open about the parameters of what the box does. So reach out to him if you have any questions about his particular device. Want to also kind of give a shout out to Thor. I had done an 8-hour training course with them a couple weeks ago. Was able to ask James, their CEO, some very specific questions about cardiovascular disease, which led me into this rabbit hole of why we're talking about this stuff tonight, is some of the questions I was up to ask him. And also always give a shout out to Weber Laser, currently wearing their Spectra watch. Weber Laser makes that endovascular laser, so people saw this on Instagram today, or saw my email to my group. They had seen me doing the IV laser, giving the red laser in my IV. That's a little bit overkill for somebody who's healthy, but if you have significant cardiovascular disease, might be something that you should consider. But Weber Laser also makes some interesting devices, and I'll give you guys a sneak peek of the newest toy I got, and we'll talk about that a little bit later. But again, I want to talk about kind of my bread and butter, that I'm a board certified cardiologist, and heart disease is still the number one thing that takes people out. Now, there's over 7 million people a year that pass away from cardiovascular disease. And that doesn't have to be that way. Most, unfortunately, is people don't necessarily know that they have the disease until they have a heart attack or have a stroke. But in my practice, I'm trying to look for the root causes way before people actually have symptoms. And so, if you've seen my previous talks, I'm talking about the CT coronary calcium score, the CIMT that looks at your artery in your neck to look at the thickness of the artery and how much inflammation's in your artery. And then the endothelial function test, or the ENDOPAT, tells you how much nitric oxide your arteries can make. The more nitric oxide that the arteries can make, the more they dilate. And it somewhat acts like Teflon, prevents stuff from sticking to the arteries, so you're not likely to build up as much plaque in the first place. The endothelium is the inner lining of your blood vessels. It's 1 cell thick. If you laid out all your endothelium, it has the same surface area of 6 tennis courts, so it's one of your largest organs. The endothelium will get damaged 6-7 years before you're going to start laying down plaque in your arteries, so you have a lot of time to be able to reverse it. And it does many things, but nitric oxide is one of the biggest things. You're going to hear me talking about nitric oxide tonight. But many people have had their blood pressure checked, their cholesterol checked, their blood sugar checked to know if they're diabetic. They know that they smoke. They know if they're overweight. So those are kind of the 5 major cardiovascular risk factors. But there's probably up to another 395 risk factors. So maybe 400 things that can damage your arteries. But the arteries always respond in 4 different ways. And I learned this from Dr. Mark Houston. He calls this 3 finite responses. The arteries can respond with inflammation, oxidative stress, or autoimmune dysregulation. And so mostly it's inflammation, oxidative stress that we'll be speaking about tonight. And that's one of the major benefits of photobiomodulation, is that it's lowering inflammation. So, as I had mentioned, I had recently done a training course with Thor. There was a study that they had mentioned that really piqued my interest. The challenges that are in the fields of photobiomodulation is there's not a lot of randomized controlled trials. There's a lot of anecdotal evidence and a lot of one-center trials that showed that there's some benefit, but it's hard to compare head-to-head at times. But there was one human trial done in Israel that was done in patients having acute coronary syndrome. They were having ST elevation MIs, which is the worst kind of heart attack you can have. But the trial was called the Adjuvant Laser-Stimulated Stem Cell Therapy to Primary Reperfusion in Acute Myocardial Infarction in Humans, Safety and Feasibility Study. So what they had done is they had 24 patients come into the hospital with a heart attack. They got usual standard treatment. They were rushed off to the cath lab, and very trained interventional cardiologists put a wire past the blockages, put a stent in, and opened up the arteries and stopped the heart attack. This study was to show if they treated the patients with low-level laser therapy, photobiomodulation, during the procedure, and also a couple days after, and a couple days after that, did the patients do better? It was a very small trial, so it did not show long-term benefit. It's probably because there just wasn't enough people studied, but it showed that it was extremely safe. And this is where the challenge gets in photobiomodulation, is knowing what dose to use. So I frequently get direct messages like, well, how long do I use this device, and how far away from it? Every organ that you're going to treat has a different dose. It's based off the mitochondria, and we're going to talk more about the mitochondria coming up. But in this particular trial, they had used, I think it was 808, if I want to remember, right? I think it was 808. Correct, 808 nanometer laser light, which is in the near-infrared spectrum. And they treated the patients over their tibia, the bone in front of your leg, for 100 seconds. And the total dose delivered was 1 joule per leg, which is what we'll talk about is the dosing coming up. It's actually 1 joule per centimeter squared, sorry, corrected. So it's the surface area that the energy was provided to. So not a lot of energy, but it was stimulating the bone marrows and the tibia. And what happened was that the mesenchymal stem cells in the bone marrow were stimulated by the light. Those stem cells then went to the heart and either directly helped the heart, or it activated the stem cells in the heart to reduce the heart attack size. So there's a lab test called troponin. It's a protein found inside heart cells that's not supposed to be seen in the blood system. If it's in the blood system, it means one of the heart cells kind of popped and spilled out its guts. This reduced the troponin levels by 50%, which is dramatic. Unfortunately, it did not show that the patients had less heart function at 9 months. Both patients' heart functions improved, so it didn't show a long-term benefit, but it showed that there's at least theoretically, you're providing more energy to the heart at that time. Maybe you can have a better effect on humans. There's lots of data in animals, which maybe we'll talk about a little bit. But they showed it was very safe. It did not delay the door to balloon time. Both times were in the 40+ minute range, which is very reasonable. So when the patient showed up in the hospital with a heart attack, an interventional cardiologist got in there really quickly and fixed the acute problem. But the goal is don't ever get that far. That's kind of what I do in my day job. But this is kind of like the end stage. Now, what can you use, when you're not having a heart attack? Well, you can use this, but there's a few things you're going to want to know about that. So, the first time that they had noticed that the arteries would dilate with light was in 1968. The gentleman Furkat figured this out, and 30 years later won the Nobel Prize for figuring out how nitric oxide really worked. And so earlier I said nitric oxide is very important for the endothelial function. He's one of the major guys that figured this out. The major way that photobiomodulation works is that it works at the mitochondrial level. It has many other benefits, but we're mostly talking about the mitochondrial tonight. So sometimes I show you guys my little Mito guy figurine. So the mitochondria, those are the organelles in your cells that provide energy. Your heart and brain have the most mitochondria, and I've heard the saying, and I always repeat it because I don't know exactly where I've heard it from, but your heart is 1/3 by weight mitochondria. So if your mitochondria are having a brownout in energy, and you can put light into the mitochondria to give them energy, maybe the heart is going to do better with that. So the major way that photobiomodulation works, and this was teased out by Tina Karu, who's the world's expert in photobiomodulation out of Russia, was that laser therapy, especially the red and infrared wavelengths of light, affect cytochrome C oxidase. And so probably not going to be the greatest because I've never been able to figure out exactly how Instagram would let me do like a PowerPoint presentation, but so I'll just kind of show it on paper. But this is what a mitochondria would look like. And then these little colors, this is going to be the different cytochromes. So when you think of cytochromes as like little fingers in the mitochondria, and they pass energy amongst themselves. Well, the fourth one, basically red light and infrared light stimulate it. And what it does is nitric oxide is kind of holding on to that spot. Acts somewhat as kind of like a regulator, prevents energy from going really fast through the system. So, if you don't need a lot of energy, you don't want your system running electrons through the system and a lot more reactive oxygen species, oxidative stress is happening, your body starts rusting faster. But the red light comes in, or the infrared light comes in, knocks nitric oxide off that cytochrome C oxidase. Electrons can then flow through the system again. And at the end of this system, there's something that looks like a top. It's called the ATP synthase. The faster this thing spins, the more energy is produced, ATP. So more ATP, more energy to fold proteins and do what your body needs to do with that energy. Side note, I did ask the gentleman at Thor about the work of Gerald Pollack. Does red light and infrared light, the fourth phase of water, the exclusion zone water, does it separate the water in the mitochondria and provide energy? He was aware of that information, but says it's not been studied and really wouldn't fully comment on, which I totally understand. But if you're very interested in how water truly works, read Gerald Pollack's work, The Fourth Phase of Water, because if his work truly comes out to be what it think it really is that this photobiomodulation also has an effect on the water inside the mitochondria that the mitochondria is making. The more light that goes into that water, the more energy is in there. It's like a battery. So if you have more battery power there, your cells can do more things that they need to do. That other than making ATP, it also briefly increases the reactive oxygen species. So it's kind of like a stressor to the system, like exercise would be. And then your body creates its own antioxidants. And so it pulls down NF-kappa beta is one of the major things that gets down-regulated with photobiomodulation. So that's basically how the main way that it works. Then there's all these other kind of tertiary effects of photobiomodulation. There's different second messengers that get activated. There's gene transcription. And different proteins are turned on in the DNA levels. Different membranes become more permeable, especially to calcium. There's different growth factors, different enzymes. Superoxide dismutase and cyclic AMP are also increased. So, the major benefits of photobiomodulation are mostly in the musculoskeletal system, but tonight we're going to talk mostly about the cardiovascular benefits. So, but before we necessarily get into all of that, is you need to know a little bit about dosage. And so I said earlier, it's somewhat challenging. And I was actually a math major in college. I was a physics major for a while and then dropped out once I got into medical school, but I still knew enough physics to be dangerous. But I will also give another shout out to another manufacturer. I have a couple of their smaller devices. I don't have one of the bigger panels, but Gimba Red has some great stuff on their website on how to calculate dosages of treatment. And so you want to work with a manufacturer that's very open about, some of the things I'm going to talk about tonight, so you can figure out like, well, how long should I use this device? And Gimba Red and EMR-TEK are very good about that. So I recommend both of those manufacturers. But there's a couple things you need to know, and if you go to their website or Thor's website, you can find the calculators. I actually put a link on my redlightdoc.com website to Thor's calculator, so if you know some of these parameters off your box, you put it in the calculator, it gives you time, gives you dose, or you get dose, you get time, so it figures it all out. But first you need to know the power, so that's expressed in watts. And that's basically how much photons are being emitted from the device. So like water essentially. So is it a fire hose that's blasting you, or is it trickling out? And it makes a difference because your cells can't, you can't drink a fire hose, so you don't need to blast all your cells with extremely high photon rates. And we'll talk about that in a minute. That's basically the power density. So that's the watts divided by the area that's getting treated. The area treated in centimeters squared, or the beam area. So if the device is right on your skin, the beam area, coming out of the device depends on what it is, you're going to get better penetration because red light only penetrates a couple, millimeters to a couple centimeters. Near infrared will penetrate, 3 to 5 centimeters. So if you have a red light that's way across the room, yes, it's hitting your skin, but most of it's reflecting off it. And you can see my face is red because most of that red light is bouncing off it. In the Thor training, so I think it's like, well above 60% of the red light, it just bounces off you. So you got to kind of figure that into your calculations. Well, how much is getting through your skin, that's getting down to your blood vessels, or getting into your heart. So after you kind of know what the power is of your device in watts, you can calculate the power density if you know the beam area, or you ask the manufacturer, what is the power density of your device. Then energy basically is watts times time. So how long are you standing in front of this device, or if it's an IV one, how long is the IV in you? That gives you joules, and then you divide the joules by the area that's being treated. That gives you the fluence, or basically the dosage. So it is a little bit like almost any drug is, there are different curves. The Anschutz curve, let's see if I can do this backwards, I'm pretty good about this stuff, is that if you get no Photobiomodulation, you get no benefit. A little bit is going to be good to a point, and then you overdo it, and then you get inhibited, and you don't necessarily get the benefit anymore. Not likely to hurt yourself with red light or infrared light, but you're not going to get what you were hoping to get. So there is a correct dose, just like Goldilocks. Not enough, not going to get benefit. Too much, you lose the benefit. And actually, that was one of the interesting things from the Thor training, was that many of the trials that show that like this laser therapy doesn't work, is they probably actually overdosed the people with light. So it inhibited the response, and it looked like the trial was a negative trial. So this again becomes a little bit challenging to say what is exactly the correct dose. So I know I just threw off a few things about how you measure dose, but there's a great article that they had written, James Carroll from Thor with a couple other authors that talked about that. If you really want to know, you need to kind of know 8 parameters. You need to know the wavelength of the device, so that's going to be in nanometers. Most stuff we're going to be talking about tonight is going to be in the red 600-ish to 800-ish nanometers. The power, we talked about watts. The spot size, how big is the light shining on you? The irradiance. The irradiance also is known as the power density or the intensity. So that's, again, the fire hose. How much of that light is coming at you? How many photons? Then the pulse regimen. So is it continuous wave or is it pulsing? So if it's over 100 hertz, it's essentially the same as being continuous. So this is really a gray zone to say, is pulse wave better than continuous? For certain things, it might be. For like pain, where they want to inhibit a nerve, you may want to do different pulsing, but that's don't worry about that tonight, essentially. But if you're reading an article, you want to know is the device pulsing or not. Treatment time, this is kind of the analogy of like a turkey in the oven. So, if you put a turkey in the oven and the temperature of the oven is room temperature, that turkey is never going to cook. If the oven is a blast furnace, the turkey's going to cook in 1 second. That's not what you want it to do either. So you need to kind of have the right time. And then you also need to know the frequency of the dosing. So is it once a day, 3 times a week? Most time, once a day is usually better than 2 or 3 times a week. But doing it 2-3 times a day, you're going to get into that inhibitory response. Most likely you overdose yourself possibly. Then the energy, that is what we talked about in joules. And then the fluence is the energy divided by the area that's being treated. So we talked about that, biphasic response. For the most part, for red, typically, this is according to Dr. Hamblin, who's again one of the world's experts in photobiomodulation, says that most of the studies show that it's 4 joules per centimeter squared is beneficial. For the near infrared, it's between 10 and 50 joules per centimeter squared. And most of the time, they recommend it daily or every other day for at least 2 weeks if you're treating kind of an acute issue. Kind of switch over. All right, so the cardiovascular benefits, I already mentioned one, was that the main way that it works is that it's providing more ATP, more energy to the cells. So if your heart needs ATP, red light can make that happen. So if you have a cardiomyopathy, that's where your heart muscle doesn't have enough energy, and you usually have either systolic heart failure or diastolic heart failure. So systolic heart failure is when your ejection fraction is decreased, your heart doesn't squeeze very well, your ejection fraction is depressed. Normal ejection fraction is 55% or greater. A diastolic heart failure is that the heart squeezes well, but the heart doesn't relax well. And it actually takes more energy for the heart to relax than it does to squeeze. So there's not great, conventional treatments for diastolic heart failure. They want to keep your blood pressure controlled, great. But, what if you could put light into the heart, give the heart more energy, and get the diastology to improve? I don't think that's been fully studied. It's theoretical, and I'm going to try to, see if it works on any of my patients who want to try it. It's very low risk, but that's something I'm going to be looking forward going forward. I also mentioned, the 3 finite responses that I learned from Dr. Houston: inflammation, oxidative stress, autoimmune dysregulation. Red light therapy, one of the major things it does is lowers inflammation. It helps regenerate tissue. So if the tissue, wounds are damaged, it helps, by stimulating collagen, improving that. There is evidence that it helps with angina, chest pain, helps with high blood pressure, maybe decreasing your blood pressure by 18 points systolically and 10 points diastolically. Helps with cholesterol, lowering triglycerides, lowering LDL-C. It's helping with lipid peroxidation. So it's not just cholesterol, it's preventing the cholesterol from getting oxidized. As long as the cholesterol is not getting oxidized, it's much less likely it's going to get stuck in your arteries. There's evidence that especially the IV blood irradiation can help with oxygenation of your blood by modifying your red blood cells. It makes the hemoglobin's affinity to oxygen better, so it can carry the oxygen more efficiently, like a big kind of ferry boat, and take it to the cells that need oxygen, because you need oxygen to make energy in the cells. It also decreases the blood viscosity, so your blood is more like red wine, less like ketchup, less likely to clot. The red blood cells are also improve their rheological characteristics, so they can bend a little bit easier and get through the smaller blood vessels. The microcirculation improves, nitric oxide dilates it, so blood flows to where it needs to go. It also promotes macrophage activities. So the macrophage is part of the immune system. That's part of the idea on the stem cells activation, is that you're turning the macrophages from something that is inflammatory to something that's regenerative. I mentioned earlier that bypass surgery was initially discovered was first tried on humans in 1967. Alexander Grunzig was a Swiss cardiologist who invented angioplasty. It's a fascinating story that he was making balloons in his kitchen, baking them in the oven, and then taking them to work, and initially using them in animal studies, and eventually somehow convinced people that he was going to put this in a person. And they we're treating people with stable angina at that point. They weren't treating people with heart attacks. That came a little bit later. Stents came later after that. But much of the data that I'm about to tell you didn't come out of the US, it came out of Russia. And because of the Cold War, a lot of this research was buried from the West for many years. But as early as 1981, they were treating acute heart attacks in Russia with red light laser devices, intravenous ones. They were using 1 to 3 milliwatt lasers for 20 to 60 minutes, 3 to 10 sessions after the heart attack. And people were having less scar tissue, less arrhythmias, bad heart rhythm issues afterwards. And theoretically it makes sense, but a lot of these trials are literally in Russian and stuff is getting translated over. And the data hasn't been replicated in the US, so it's not in their mindset that we're going to try this anytime soon for acute heart attacks. But there's also evidence that for less acute issues, it's lowering fibrinogen, again a clotting factor. It may decrease aortic aneurysm progression. The Thor people were working on a giant laser cluster and an intravascular laser that could treat the inside of the aorta and potentially prevent the progression of an aneurysm so that it doesn't rupture. And in my world, when I talk about endothelial function, there's data that this may actually make the endothelial cells increase by 1.8x. And so if you have more endothelial cells that are healthy releasing nitric oxide, you're less likely to be laying plaque down in the arteries. So I think that was the majority of the stuff I want to talk about tonight. I know it's a little bit of a fire hose of information. I don't mean it to be that way, but sometimes when I get on a topic, that's how it comes out. But I definitely do plan to talk more about these topics as I teach myself over the next few months. For now, I'll kind of be show and tell and then open up to some questions here. But if you want a good book about IV blood irradiation, the ISLA organization has a book that explains everything about IV blood irradiation. Maybe I'll talk a little bit about my experience with that. So I had an IV placed in antecubital vein, and then because I knew some of this information, I mostly picked red laser and then also did UV. Those are the two colors that are mostly used in most of the photobiomodulation research because the topical ones, those can actually penetrate below the skin and get into the blood vessels, potentially get into the heart as well. And definitely can get to the tibia, the stem cells on the front part of your legs, the mesenchymal stem cells in the tibia. But in the IV laser, then you can use different colors. You could use blue, you could use green, you can use yellow. But for the most part, if you shine those on the skin, they don't penetrate the top layers of skin, so you don't get a systemic effect with them. But for patients who have cardiomyopathies, there are protocols where you would get IV laser 2-3 times a week for 20 minutes using the red laser, 5 milliwatts, and the total dose of it was like, don't quote me exactly, but I want to say something like 16 joules. And then you could use different lasers that affect different parts of the cytochrome. So the green one can improve oxygen as well. The blue one can improve nitric oxide, improves ATP production. So the IV laser is very fascinating. Again, most of the data is coming out of Germany and Russia. There's only a handful of people in the US that have one of these things. One of my colleagues here in St. Louis has one. I've been kind of have to go play with a couple times and hope to do it again in the near future. So probably do another talk at some point just exclusively about IV blood irradiation once I read a little bit more and get a little more experience with it. And then, let's see. So I already was showing people this one. I know some people have seen this before, but this is the Weber Medicine Spectra watch, and you can put red. There are the other colors too, but I mostly do red. And the red light shines up into your radial and all in the arteries, and you get external blood irradiation. The closer it is to your skin, the more photons penetrate into the blood vessels, and then the blood vessels, they carry that light energy like a ferry boat to where your body needs it. Then I'll show my other toys while we're chatting. This is the Firewave by EMR-TEK. I only have the external bulbs on because, well, I'll turn the center bulb in and I'll blind you guys for a second. But the center bulb's 200 watts, so hey, this is what you want to turn on when you actually want to do photobiomodulation. Otherwise, you can just leave the outer ones on if you just need to kind of illuminate the room or kind of balance out some of the blue light coming from your technology. And then recently the Solbasium company actually sent me a device similar in form factor to one of the other devices I previously had, but this one is kind of interesting because it has the ability to do red, near-infrared, and red and near-infrared all together. And it's portable. It charges up with a USB-C cable and has 12 little LEDs, and it's, let's see, max power is 12 by 3 watts, so 36 watts. And then I don't know, off the top of my head, I have the colors memorized off the top of my head, what are the red and what are the infrared wavelengths, but probably mid 600s and low 800s on the near infrared. So I'm gonna start playing around with this a little bit more for collagen wrinkle prevention, and also for heart. You can shine it over your heart once a day. Use like 15-20 minutes, but I'm going to be a little bit more precise now that I know how to actually calculate the dosages. But you can also get something like this and shine it on your tibias to stimulate your stem cells. So start thinking about doing that. And then the toy I definitely want to play around with more, and I've actually had some benefits with it. That is the Weber laser helmet. And I don't want to mess up my hair tonight, but I'll do it another time. But the Weber laser helmet has like over 300 810 nanometer LEDs inside, 16 watts of power, and brain irradiation penetrates like 5 centimeters, and very interesting data on strokes, traumatic brain injury, depression, Parkinson's, Alzheimer's, memory consolidation. So fortunately I don't have any of those conditions, but what I've noticed so far with me using it is you can set it. Usually it's 15 to 30 minutes a day is kind of the time, but you can pulse this one. So I usually will pulse it at 10 hertz, which is the same frequency as an alpha wave. And so what I've done for myself, I didn't read it anywhere, but I've been a pretty routine meditator for the past 3 or 4 years, is sometimes I'll put this on and meditate with it on, and I just notice I get into a very deep meditative state when I set it at the 10 hertz. If I want it to be more stimulating, I turn off the pulsing and make it continuous. I usually do like 20 minutes continuous, and it kind of turns the brain on because it's directly stimulating cytochrome C oxidase, releasing nitric oxide from that spot, making more ATP, so you have more energy in your brain directly, because you can't store energy in your brain, so you got to make it, and when you have that energy, you can think better. It also stimulates blood flow, so if you provide more blood flow to the frontal lobes, your memory consolidation, your executive functioning, your speech tends to improve. So noticing some significant biohack improvements in myself. Once I kind of work out a couple of the kinks, then I'll probably start offering to my patients here in St. Louis. So I think that's all I had in my notes. Let me double check, make sure there's nothing else I need to hit upon tonight. So I do want to thank everybody for tuning in tonight. I will hang out and answer some questions for you. But for those that are new to follow me on Instagram, welcome. I do have a plethora of videos on my Instagram TV talking about various biohacking things and cardiovascular testing that reduces your risk of heart attacks. So for the people that aren't watching me on Instagram, consider watching me on Instagram, because usually in my IG stories I will put kind of what biohacks I'm currently doing, and I can kind of give you a day-to-day synopsis of what I'm doing. And then I did talk about earlier, but I did launch the website redlightdoc, doc.com. And I'm not a web developer, so forgive me, it is just WordPress, but I did get it put together decently. And so there's some good links at the top that go to a photobiomodulation calculator, some links to some articles that I'm gonna post up there soon, and then have a link to the EMR-TEK referral link, and then also all my videos that I've currently done for photobiomodulation, as well as sauna. And then once this one's all recorded, then I'll put that one up there as well then. So again, thank you guys for watching tonight, and we'll definitely have some more photobiomodulation talks in the near future. So now open it up to questions. So yes, this is being recorded both on Instagram TV and on the computer, and I always have backups because every once in a while one of these things glitches and I end up messing up the feed. So there'll be backups. So it'll be on IGTV and potentially be up on YouTube. Great question. What time of day do I suggest using red light? For the most part, recommend people use it during daylight hours. My own personal experience, I'm up before sunrise, so I protect my eyes from blue light. And then I usually have one of these red light devices on in this room. I'm not usually on the computer before sunrise for the most part. But usually illuminate the house with red lights before sunrise. And then I usually kick them off. But if I was going to do a treatment, I would only do it during daylight hours. It's mostly based off of the irradiance, the intensity. So if you have a very high powered device and you're standing very close to it, it's not going to be like blue light or green light that affects your melatonin. But if you use too much red light at high intensity, like a fire hose level, you potentially could affect melatonin and would affect your sleep. So don't use intense red light right before bed. If you have red light bulbs, and you've seen me give talks about red light bulbs, red light bulbs aren't photobiomodulation devices. They're very low power. They're not going to affect your melatonin. I'm just talking about one of these really high powered devices. And question, after exercise for recovery? Yes, I mean, that's the main use for photobiomodulation is for muscle health, but tonight's focus was on cardiovascular benefits. So there's data that you should use it before exercise and after decreases the delayed onset muscle fatigue. Will it increase autophagy when fasting? I don't know. I don't know if that's been ever studied. Question, people say they have a Firewave and want to know what the middle light is for. So that middle light, that 200 watt globe, that's the main photobiomodulation feature. The outer rings help. Those are more kind of to light up the room, but you need to turn on that central bulb to get the benefit. So, typically recommend people standing, maybe 15 inches away from the box on that particular model. But again, it's apples and oranges. So if you don't have a Firewave, you have to ask your manufacturer what the dosing parameters are. Or be a biohacker and look at the stuff on the back of the panel and kind of reverse engineer the dosing yourself. Somebody went to my site. Will it replace or be inclusive? No, my main website's always going to be the Dr. Twyman, Twyman, TWYMAN.com site that has links to my current practice of polycardiology, has all my other kind of podcast and non-light related talks. The Red Light Doc one was just something that I put together that, because people ask, where can I see this video? And it's like, just go to Red Light Doc. And also the links to any of the devices I use, I'll eventually kind of work on putting them up there as well. All right, so I'm going to scroll through a couple Instagram ones and see what questions we got here. So question would using the Gimbal Red panel on the tibia daily be a good preventative therapy? Possibly. They have a couple different panels, so I don't know which one you're speaking of. Some of them I know, can be right up to the skin. Other ones they recommend you stand at least 6 inches back, I believe. Because that is one question is, what are the non-native EMFs coming off the device? A quality manufacturer is going to give you the information of what the non-native EMFs are off a device. But it's potentially a good therapy. Now the dosing, that's anybody's, not guess, you'd have to go to the actual trials and figure out what dose it was, and then look at your panel, and then that would help you kind of reverse engineer how long you would use it for. So you could use that Thor calculator. It's on my website, the Red Light Doc. It links off to there. Correct. Yeah, so am I correct in understanding that placing the light directly on the skin is best to prevent scatter? Correct, yes. In the Thor training, they talked about rats. Light can be reflected, so basically bounces off your skin. It can be absorbed, so it goes through, goes to that cytochrome, and basically it's like Pac-Man. It eats that photon and then does what it needs to do. It can be transmitted, so it just goes straight through and goes out the other side. That would be more like ionizing radiation, so X-rays go right through you. And then it can be scattered, where it kind of bounces around like a pinball, and eventually it either gets absorbed by something or then it comes out the other side. So for the most part, the closer you are to a device, the less scattered it's going to be. But again, you need to know what the non-native EMFs are coming off of your device, because you don't want to put something in your body that makes things potentially worse. So, the good news is that if you have a very, quote, high-powered device, many times you're a couple inches back, the non-native EMFs are, trivial. But again, it's test, don't guess. Get your own meters out and test what the fields are yourself. Correct. It's basically for both. The question is, to get the prescription for the right amount of red light, should we ask the manufacturer, or is that for the IV therapy? The IV therapy, they basically have a standard protocol, so you don't necessarily need to know that one. But for each manufacturer of the devices, they should be pretty forthcoming with the dosing recommendations. But again, those people are not medical people. They're just going to say, well, in our experience, this is what we've seen been beneficial. For the most part, you have to be your own, citizen scientist. You have to go looking at the original articles, find out what dose they actually use, what nanometers of light, those 8 parameters I talked about before, how long, how frequent, and then use the calculator from the Thor website to figure out the timing for your particular device, because it is apples and oranges. I was trying to do these calculations today, and again, like I said, I was a math major. I love Excel spreadsheets. I was trying to figure out how to do a calculation from one type of device to another type of device. It took me over an hour, and I think I got it right, and but I'm not 100% sure just yet. So it's tricky. So it's usually best to start with the manufacturer of the device, to ask them if they have the parameters. But then, as I learn more, I'll put more information up on my redlightdoc.com site. You can also, if you follow me on Instagram, send me direct messages, and I'll answer them there then. Question, how long does a dose last before you have to dose again? It depends on what you're treating per se, but for the most part, once a day is usually optimal. You don't have to go for a full therapeutic dose every day, but it's sort of like sunlight. You should be outside every day, and for the most part, if you know what you're doing, you get the correct dose of sun. It's when people aren't used to the sun and they go outside for 12 hours a day and injure themselves. Same thing with red light. If you don't know what you're doing, fortunately, you're not necessarily going to injure yourself with it. You're just not going to get the benefit. So, for the type of device you got, probably 15-20 minutes a day is probably the most you need, but we can kind of work on better dosing parameters as I know more. Do I tend to move the red light devices from room to room or keep them stationary? For the most part, I keep them stationary on a desk and then move them in front of whatever I want to treat. For the most part, I treat chest and face, and then if I mess something up musculoskeletal-wise, doing some exercise, then I'll shine light on there. So I'm fortunate that I have a few of these other gadgets, so I can kind of move them around. So I've really been enjoying playing with this portable one, because then you can just put it right near what hurts. And I mostly use the EMR-TEK to kind of light up the room, and then really when I want to kind of treat the whole front area all at once. All right. It wasn't really the focus of this talk tonight, but the benefits of UV blood irradiation. There's a couple ways to do it. I don't do this myself in my practice, and I've not had the one done. I've done the Weber endolaser, where you essentially have an IV put in, and there's a fiber optic cable, and it's hooked up to a UV diode, and then it's putting UV energy into the blood system. That's potentially antimicrobial, antiviral, but the reason I was considering was more kind of the data of Gerald Pollack, the 4th phase of water, is that UV light can help charge separate the water, so put more energy into the water. Most uses of UV blood irradiation you're going to see is mostly for infections. They'll take the blood out and they'll pass it through a UV light and then re-inject it back in. So with the Weber laser, the blood never leaves your body. But there's things called like 10 pass. For the most part, they have to kind of anticoagulate your blood so it doesn't clot when they're putting it back in. But may be beneficial for chronic infections, and that's the main benefit is infections. But probably a cardiovascular benefit as well. I know in Russia they were doing it more frequently. I've personally not necessarily seen it for cardiovascular use in the U.S. that way, but it's definitely possible people are doing it. it's just not well publicized. No, I have not made a particular formula for use parameter for various red light manufacturers. A couple of the ones like particularly that I own, I'm starting to put some of those together. But again, those are things that, I'm not going to ever be able to go out there on the internet and tell you, use this device at 15 inches for 20 minutes to get this dose, because then that's practicing medicine on the internet. I'm just kind of give you general parameters. If you see me in the office and you have a particular device and I can get the data off of the device, then I can help you kind of try to calculate that for yourselves then. Question, will I be offering consults to people who want specific dosing info about their health conditions? Yes, I'm interested in kind of expanding my cardiovascular reach from the St. Louis area. And so even if you don't necessarily have a cardiovascular issue, I am doing some biohacking, health optimization consults via Zoom. So if you're interested in doing that, just send me a direct message, say something like, biohack and interested, and I'll message you back and kind of find out, if there's something that, you need me to work on, and see if we can meet up sometime. Question, can I treat the head with red light therapy, and if so, will it help with brain mitochondria? It's possible, but the challenge with red light specifically is that it doesn't penetrate very well, so it's not necessarily going to get through the skull that easily. So most of the brain studies are done with near infrared, usually in the low 800 nanometer range. And the Weber the Weber laser helmet all is 810 nanometers. There's no particular red light therapy with it. That's a great question. What plays a bigger role for cardiovascular health, diet or sunlight? I'm going to go sunlight, or just light in general. Light sculpts your life. Light sculpts food. If you're eating real whole food, if you're eating stuff out of a can or a factory, that's not really food. But sunlight is going to be the major driver of health. Question, I've read that red light therapy can alter the gut microbiome. Yeah, that's correct. So, your gut is your interface to the environment. So when you eat food, you're basically digesting light. So if you put red light, over your abdomen, that red light is talking to the gut bacteria. So definitely can affect the gut microbiome. Same thing as, that can help is the Zeitgeber of timing of your meals. So there's some guy online, I always said that, I always try to throw in the word Zeitgeber to talks, but Zeitgeber is the German word for time giver. So light that enters your eyes and hits your skin and your gut is one thing, but so is the timing that the nutrients go in. So, if you follow the work of Dr. Panda, 12-hour or less window, that liver and gut clock can shut off. The good bacteria have more chance to propagate. Great questions tonight, guys. This has been phenomenal. So I'll stick around for a little bit longer, answer a couple more questions if any are coming in. But I do thank you guys for joining tonight. This will be up on IGTV when this is done, and probably be up on my website in 24 hours or so. We will be doing more talks about photobiomodulation. Definitely talk about the Weber helmet and show you guys some of the benefits I've had personally, and then maybe we'll have it out in the office at some point for people to try out. And then if there's a particular topic of light that you want me to try to speak on, just send me a direct message or email, and then I'll do my research, and then we'll add it to this Monday night rotation. We're going to keep doing these Monday nights, 6 o'clock Central Time from here on out. Question, right now somebody here is in California, stuck indoors because of the fires and hazardous air. What can we do? Meantime, the air is safe to breathe. Photobiomodulation is something I would consider. It's never going to replace the sun. I sometimes will jokingly call it a sun supplement, but you can get some benefits with just using photobiomodulation until the air is cleaner. Yeah, and if people are interested in signing up for just a red light consult or photobiomodulation consult, send me an email. It's Dr. Twyman at apollocardiology.com, or if you're on Instagram, just DM me, and we'll figure it out. Question, would red light in the stomach at night confuse the gut microbiomes as far as circadian timing? Again, unknown. I would say I would focus on trying to use red light, the way Mother Nature intended it. So for the most part, most red light is out from sun up to sundown. Yes, there are some infrared because, the sun would have heated up rocks, and the infrared is bouncing off the rocks at night. So when you're out in the desert, it's still hot at night. But keep most of your biohacks, in tune with what the circadian rhythms would have told you to do. And somebody says they're down in Orlando, Florida now, getting lots of sunlight. Awesome. You're doing it the natural way. That's always the best way to do it. All right, everyone. Well, we're 50 minutes in. I thank you guys for joining tonight, and we'll see you again next week. And stay well. And if you need anything in the interim, shoot me a message. We'll see ya.